Good evening, students. It's good to for y'all to see me. I wish I could see you, but it won't be long. In July, I understand that you get to come back to school. I want to remind you that if you have long hair, you need to pull that back in a ponytail. And also, don't forget to show your student ID, your name badge. I'm sitting at the nurse's station and I am reviewing my patient's chart. I see that the doctor has ordered an IV for Miss Tweety Bird. And he has some Lasix and some Rocephin ordered. So that means I'm going to have to start an IV. Okay, let me look further in her chart. No, there's no allergies. I do not see any history of congestive heart failure, renal disease. I do not see any medical history of her having a mastectomy or an AV shunt for dialysis. There's no history of a stroke. Let me take a look at her lab values. Okay, all right, and then her vital signs that she had taken just a little while ago. Okay, all right, and I do not see any surgery impending or any particular radiology procedures. Oftentimes, you'll need to put a certain size IV in if you know they're going to be going for surgery or a certain procedure. Okay, now then I'm going to, let me go ahead and just pull the MAR and the doctor's orders. Just pull those right out of the chart, and I'm going to go into the med room and I'm going to gather up my equipment. The first thing I want to do is do hand hygiene before I start gathering equipment. So I'll put a couple little squirts on that and I want to rub it in until it's completely dry. Okay, so I'm going to choose, usually for an adult, a 22 or a 20 will be good. But sometimes if they're older, they have fragile veins, they may need a 24. So I'm going to take one of each size with me into the patient's room, and I will need some flush. I normally would take 10 mils of flush, but I know that you do not have a 10 mil syringe. So you're going to have to use your 3 mil syringe that you have and pretend that it's your flush. And I know that you do not have a cap to put on it. So you will need to leave your needle on your syringe to keep it sterile. But I understand, and you will just say that you have a sterile cap on it and that it's really 10. When I initiate IVs, I like to use 10 mils. Then I know for sure that's enough fluid to prime my little extension tubing, and it's also enough fluid for me to flush and observe for swelling at the site. And I don't have to be anxious that I might be running out of fluid. But for routine flushes, you would just only need 3 mils. Okay, you'll need an IV start kit, your extension tubing, and I'm just going to take some extra alcohol preps with me. You just never know when you might need a little extra. Okay, So I believe that I've got all my supplies, and these are my cheat sheets. And you will have a copy of these as well, so you'll be able to be reminded of each step that you need to do. Okay, now I am moving into my patient's room. I'm going to do hand hygiene. Okay. Miss Tweety Bird, my name is Sherry Cusinelli, and I'm going to be your nurse today. The doctor has ordered an IV, some IV meds for you. So the first thing I've got to do is put your an IV catheter in. Have you ever had an IV before? You have. Okay. All right. So then you kind of know what to expect. I didn't see any allergies noted in your chart. Do you have any allergies? Like, are you allergic to shellfish or iodine? Alcohol? Okay, you don't have any allergies. Okay, well that's good then. We'll go ahead and proceed. I'm going to raise your bed up just a little bit so that I don't have to bend over. And then, would you like to have your head up just a little bit? You're good. Okay, well I'll just leave you right like you are. Okay, I have washed my hands already, and I want to open up. Let me get my supplies all done. I brought some disinfectant spray, so I'm going to spray the little my work table here, and I'm going to wipe it off. Okay, and I'll throw that into my waste basket. And let's get out my supplies. And I'll put them out. I want to drape the little disposable drape here on my table and organize my supplies. Okay. And here's the sharps container. Okay. And I'll decide on which IV after I have a chance to look at her veins. Okay, I'm going to go ahead and open up the IV start kit and see what goodies we have in here. Okay, I'll take the all right, and we'll take the, this is a transparent dressing, and we have tape and a tourniquet. Okay, now then, and this right here is the chlorhexidine gluconate, which is a preferred cleaner. So if you have one of these in your IV start kit, this is what is preferred for cleaning, but alcohol preps have been used for ages, and this particular start kit does not have the iodine. Sometimes you'll get a 2%, or I think it's 0.2% tincture of iodine that can be used for cleaning, and your choices kind of depend on if your patient has an allergy or sensitivity, then you might use something different. All right, well what I want to do first is put this tourniquet on, and I have very good lighting. I mean, it's directly right over where I'm working, so that worked out great. Okay, so I'm going to put this, and I'm going to, I know that I'm going to be doing it in the hand, so I'm going to go ahead and put this tourniquet on. Okay, and you want to do it so that you can just pull that out. Let me do it one more time. Make sure that you can see how to do it. So you lift the arm up, and then you just, let's see, fold it over, and I'm going to pull a little bit and tuck a loop underneath. Now you want to make sure it's not too tight, and the easiest way to do that is feel of the pulse. If you can feel the pulse, it is not too tight, because you do not want it to be so tight that you occlude the artery. Okay, now then, it's not going to be possible in the way that I'm working, but on your patient in the hospital, you would want them to dangle their arm beside, if they could hang it off the bed, that would even be good, because gravity is your friend, and that's going to help those veins to dilate and be filled with blood. Okay. Oh, Miss Tweety, I see that you've got some very good veins. You may even want the patient to make a fist and release it. Make a fist and release it. Also, you can take alcohol or even your finger. If it's dark-skinned people, you definitely want to use some alcohol, because you can rub down and it'll help those veins to show up. Or you can take your finger and rub along it and see if you have a vein that kind of pops up a bit. Okay, now then, what I'm going to do, I see a perfect vein that I want to use right above this bifurcation right here, is where I want to use. So I'm going to go ahead and release the tourniquet, and I'm going to get my extension tube primed. Okay, now this is sterile, so I want to make sure that you do not touch this area right here. And here is my flush. Now this flush would be in a little plastic bag, so you take it out of the bag, take the top off, and it will be an air bubble in there. So depending on the manufacturer, some flushes you have to pull back on the plunger to release the pressure. Or when you go to get that air bubble out, it's going to shoot all the way to the ceiling. So I just always pull back on it just in case. I don't know which manufactures which flush that shoots to the ceiling. So just pull back on the syringe, on the plunger, pull back on the plunger to release the pressure, and then you'll push it up to get the air out. Okay, so all the air is out. And then I want to, see, this is sterile, so I do not need to clean this with alcohol. But if for some reason you touched it, or it's touched in some area that was not sterile, then you will need to clean this with alcohol. Scrub it for 15 seconds. And then you will push down and turn. This is called a lure lock. So you push in, because it has a valve in this injection port here. Push in and turn. Okay. Now then, I'm going to prime my tubing. Now I only have air in my syringe, and that's all you will have in yours. But we're pretending that it's fluid and it's going all the way in. Okay, I have primed it. Now then, can leave this top on because it keeps it sterile. Now, in practice, what I like to do is take the top off and lay it down in my little package. If I have a little package, see how it's kind of like a little boat? Sometimes your kits just come in a flat package and you don't have any depth, and it's very difficult to just lay it in there. So if you have to put this beside you, leave this sterile top on. If you are able to put it in a little boat, do so. And you'll see why that's important a little bit later. Okay. Okay, now then, this is something that you can decide about. You can go ahead and put your gloves on and do your tourniquet up And let's see. I'm going to put some gloves on. No, I'm not. I'm trying to decide which way I want to do it. I think I want to go ahead and clean first. You can put your gloves and tourniquet and all that on and clean. This, since I'm using this, I do not have any cleaner on my hands. I'm not touching anything, as though if I was using an alcohol prep, I would probably want to use gloves just because alcohol is so drying. And so when I use alcohol, I like to have a pair of gloves on. Alrighty, so this particular kind of, it's called a sep. See the wings. You have to push this in to break the ampule that's inside there. And you hold it down and the cleaner will fill up this sponge. So after you can watch it, you'll see it getting wet and it will be filled up with the cleaner. All right, so I'm not gonna actually do it because I have a feeling that my marker may just smear and everything. So I'm trying to do everything dry. And you can do everything dry too. Okay. Alrighty, so I see where I want to do it. So I'm gonna do, because this is a round circle, I tend to go in a circle, but some of these are rectangle shape and you can just go back and forth. So I like to start in the middle and work out. And I like to do a little bit more than where the vein is because it's a possibility when I put that tourniquet on, and I might change my mind about the vein that I'm going to use, and it'll be good to have already cleaned the area. So clean and go wider than you think you need. Okay, when you're finished with your cleaner, you put that in your wastebasket. Okay, now then, I can see that she's got good sized veins, but I like to use the smallest needle possible. So, because she's not going to have surgery, she's not having any procedures, and it's just a smaller needle. So the larger the number, the smaller the needle, the diameter is what it's measuring. So I'm going to open up this, okay. And I like to just go ahead and make sure the top comes off good, and then I'll just kind of, I won't click it back on. I'm just going to let it sit inside the top and put it on back in the little pouch here. And it'll stay sterile there. Okay, now then, I am ready to, and I'm going to do the tourniquet before I put my gloves on, because oftentimes when you're trying to tighten the tourniquet, your glove gets caught. So I'm going to go ahead, and we're doing this tourniquet about, I probably could bring it down about 4 to 6 inches above the site. So I'm going to bring it down just a little bit. Let's see. And I've already cleaned this area, so I want to be sure not to touch it. But if for some reason you happen to touch it, you'll just need to go back and clean it with some alcohol. So that's one reason to always have some extra alcohol with you, so that you can do another quick clean, or at the end, if you've made a mess with blood, you will need some alcohol to clean that area. Okay, now then, I want to go ahead and remove the top. I think I'll just let it sit right there. Okay, catheters have bevels just like your needles that you put on your syringe. So you want to have the bevel up, and you'll be able to see that. And if I can get the video person to come a little bit closer, I want you to see this little tab that sticks up. Now, not all catheters are the same. Now, these ones, let's see, I believe this was a gel coat. I didn't even notice what type it was before I put the paper into my wastebasket, but I will have to get that because when you document, you need to know what type of catheter that you're using. But I like this kind because it has that little tab on top, and that will be very helpful in pushing your catheter into the vein. The needle does not go into the vein, only the catheter. Okay, so we have cleaned our area, and I want to take my thumb and I'm going to pull this skin down. Pull this skin down tightly. And if she has roly veins, you can even put another finger up here to support it. Sometimes even having the patient make a fist while you put the catheter in will keep the vein from rolling. Okay, I'm going to stick at about probably about a 15, anywhere from 10 to 30 degree angle. Probably 15 is it's probably a better angle. And I just lost my train of thought. I know what I was going to tell you. And you want to do it on top of the vein. So you will come in at an angle and you're going to stick it. Okay. And you want to get in just enough for the bevel is covered. And if you are in the vein, at this point you will get what is called a flashback. And it's a flashback of blood. And you will see it in this clear part of this catheter that I'm holding. Right here where you see my finger, you'll see blood. And then that's when you say hallelujah. Because it is so, such a good feeling to know that you have got that flashback. Okay, so when you get that flashback, you're going to just go about 1/4 of an inch, 1/8 to 1/4 of an inch, just a little bit more while you're putting that catheter parallel to the skin. You're going to make it flush just right on the skin. Okay, I went just a little bit more. Now then, I am going to pick this hand up and I'm going to put it on that tab because this is going to slide the catheter in. So the catheter goes in. Okay, and I'm not going to take the needle out just yet. This is very important. You're going to reach up here and undo your tourniquet. Because if you take that needle out and it's under pressure from that tourniquet, you're going to have blood everywhere. You're going to need more than an alcohol pad to clean up. Okay, so now then, blood can still come out of this catheter. So I want to put some pressure, now not on the catheter, so above where that catheter would be in the vein, you're going to take your finger. I'm going to use my middle finger. You want to use your middle finger or your ring finger because you're going to need your thumb and your forefinger to stabilize the catheter, as you will see. So I'm going to put my middle finger right here and press down. Okay, and I'm going to hold it. See, it tried to come out. Okay, I'm holding pressure. So this would go in my sharps container, but you probably won't have time to take it to the sharps at the moment. The safety was automatically engaged on these particular catheters, so it's not a safety hazard at this point. But we will put it in the sharps container in a little bit. So I am putting pressure on this. Now this is why I like to have the top already off, because this has to be done quickly. You're going to quickly connect this to the catheter. Okay, so now that I've got it over and I'm screwing it tightly, I can release that pressure. Okay, so it's tightly on. That's
why, because it needs to be quickly, that's why I like to go ahead and take my top off. But see, all of that depends on what kind of receptacle that you have, because you want to make sure that this is kept sterile. Okay, now then, I am holding, stabilizing this catheter while I flush. Now, while I'm flushing, I'm going to be looking at this area to see if it swells. And I want to make sure that it flushes easily. It's looking really good, really good. So I'm going to go ahead and flush it all the way. Okay. And I just remembered that I forgot something. And I'll just do it now. But you should have done this at the very beginning, is put you a towel or a pad under the patient's arm. That's to protect the bed linens. Okay? All right. Sorry about that. So just remember to put your pad under the patient's arm at the beginning. Okay. Now then, what I want to do, this reminds me also, I did not have my tape ready. Okay, I'm going to let go of that for a second. And let me just get some tape ready. I apologize. It's late at night, but because you've probably experienced, it's hard to handle tape with gloves on. So, if I can get the photographer to come over, the videographer to come over. Now, on your bedside table, you would just put your tape, they're sticky, just have it hanging down. So, that was one piece of tape that I tore in two. And then I will take another piece. I'm just going to stick it to the edge. We're pretending that's our over-the-bed table where our supplies are all at. So you have it ready like that. Now, so for years, for 5 years or more, I would say, we quit putting tape underneath the catheter hub. But in our new Davis book, it says to make a chevron. So you have to, and this can be very difficult for students to do. And you crisscross across the top. Now you want to make sure that you do not put any tape over the side. Now, what we have been teaching the students for the past 5 years is that when you get your IV catheter in, then you can put a little narrow piece of tape just across the hub. And then you would open your transparent tape and put that down. I'm not one for wasting anything, so you could use your other little narrow piece to go across and do one or both, or one or the other, or do them both. And then you're going to take your transparent dressing. And it's important that you do not put tape or the transparent dressing in this junction right here. Do it better. I'm going to point with this little thing. Right here where it connects, you do not want to put any tape or dressing, because you want to be able to change out this tubing if you need to without having to mess up the taping or the dressing of the catheter. Okay, so I have taken the back off of this. Now this is adhesive and it's very sticky. So very carefully place it down it out, and then see how it lifts up. As you go around, put your finger down to press it. You want it to be as wrinkle-free as possible. On this particular dressing, it has a place to write your initials, put the date and the gauge, so that was a number 22, and also the time. I like to for students to add the time. So that is, so you can fill that out, and then after it's filled out, you can pull it off. And you do not want to cover the site, but just somewhere off to the side, if I can get it to cooperate. I'm going to stick it on there. Okay, so that'll have your date, your time, your initials, and the gauge of your catheter. Now at this point, we're going to take our syringe off. And this is a pretty long extension tubing. I don't recall what extension tubing is in your skills kit. I just got this one out of my supplies that I have at home. It seems to be a little bit longer than what will be in your skills bag, if I remember correctly. But after you flush, and I did not mention this, this has a clamp on it. So after you flush, if you would engage that clamp, that keeps blood from backing up into the tubing. Okay, then you just want to loop this around and tape it. Put a piece of tape. Well, I think I am. I'll put a piece of tape across here. Want to be able to clamp and unclamp. And then I think I'll put my second piece of tape across here. Again, I am not covering up this junction right here. Okay, then we have it. There was, of course, we didn't use, have any real blood or anything, but let me say that before you put your tape and your dressing on, if you have gotten some blood or made a mess, take your extra alcohol that you brought in with you and clean. But you have to be very careful because you are holding on to this catheter while you are cleaning. You cannot let go of it and let that catheter come back out. So be very careful, but you don't want to put tape or a dressing over an area that's not clean. So if it has any blood on it, you have got to clean that first and let it dry before you tape it up and put a dressing on it. And alcohol doesn't take long to dry, probably just a few seconds. Alrighty, so now that I'm through with that, I'm going to gather up my supplies, take this to the sharps container, and I'm going to dispose of all my supplies. Wrap all of this up. Put this in my trash. Okay, and remember how to take your gloves off. Pull in the middle to get it off. Hold it up. Slide your finger underneath and pull it off. And then it goes into the garbage. Alrighty, and then you'll do your hand hygiene. Okay. Alrighty, Miss Tweety Bird, we've got your
catheter in and everything. Does it feel okay? Okay, will you let us know if there's any discomfort there? If you feel any pain or burning, you let us know. If you notice that it's swelling or anything, you let us know. And I'm going to go now and I'm going to document what I've done. And remember, I said the doctor has ordered some IV meds for you. So I'm going to go and check and see if the pharmacist has the Rocephin is what you're going to get. And you got some IV Lasix to take. And I'm going to see if he has dispensed your medicines. And then I will be back to give your medicines. Okay, so I'm going to put your bed back down because we want it to be in the lowest position for your safety. And then let's see, we'll make sure you've got your call light right here. If you need anything, you be sure to call, okay? If not, I'll see you in just a few minutes, all right? Okay, bye-bye. Oh, don't forget to take the pad out from under the arm. Put that down. Okay, that was something else I forgot. Okay, well, alrighty, students, that's the end of part 1. And then in the morning, I'm going to make part 2 of your video. And it's going to be giving your IV meds and then taking out the IV catheter. So I'm going to leave everything like this here. And I will see y'all in the morning. Good night. Bye-bye.